Kindly settle down, ladies and gentlemen. Ladies and gentlemen, a very good morning and a warm welcome to the inaugural function of the 60th Institute Day Celebrations 2015. Since its inception in the year 1956, A.I.M.S has steadfastly maintained and upheld the principles and mandate given to it by the Parliament of India. Over the last 59 years, A.I.M.S New Delhi has been propelling medical education and setting new benchmarks in medical research and patient care, the very goals for which it was founded. This year, we also enter into the 60th year of our commissioning. This day will also mark the launch of the Diamond Jubilee celebrations, which will continue for the entire year, highlighting the excellence and achievements of the Institute. We are indeed proud and privileged that despite his very busy schedule today we have amongst us our President and the Honorable Union Minister for Health and Family Welfare, Government of India, Shri J.P. Nadda ji, as our chief guest. We welcome you, sir, on this august occasion. We also have with us today our beloved Director, Professor M.C. Mishra, whose vision and guidance over the last couple of years and the resultant change at the Institute is there for everyone to see and feel. We also welcome on the dais Professor A.I.I.M.S, Chief of the Cardiothoracic Center and Dean Academics, All India Institute of Medical Sciences, Professor A.I.I.M.S. Professor S.K. Acharya, Head Gastroenterology and Human Nutrition and Dean Research, All India Institute of Medical Sciences. And Professor O.P. Kharbanda, Head, the Center for Medical Education and Technology, which is the nodal department organizing the Institute Day celebrations this year. Welcome, sir, and welcome all. Without wasting any further time, I would like to call upon Professor M.C. Mishra, Director A.I.M.S New Delhi, to give his welcome address.
माननीय Shri J.P. Nadda ji, Union Health Minister, and also the President of All India Institute of Medical Sciences, New Delhi. Thank you, sir, for being here. Professor A.I.I.M.S, Dean Academic, Professor Acharya, Dean Research, Professor O.P. Kharbanda, Chief, Center for Medical Education and Technology, distinguished faculty members. I also welcome Dr. Raja Sabapati from Ganga Hospital, Coimbatore, who is going to deliver Silver Jubilee oration later this morning. Professor Julka, Professor Kotwal, Professor Sharma, Chief RP Center, other senior faculty members, distinguished faculty, nurses, students, residents, officials from the ministry, media, friends, ladies and gentlemen. It is indeed a great privilege for us and a heartening moment that we are now entering into the the Diamond Jubilee year of All India Institute of Medical Sciences. This is the 60th Institute Day, and 60 is a very important number for any one of us, and many of us have spent actually more than half of our age at this institution. So मैं सभी को 60वें इंस्टीट्यूट दिवस पर बहुत बहुत बधाई देता हूं, और मैं उम्मीद करता हूं कि इंस्टीट्यूट नई ऊंचाइयों को आने वाले समय में सुनेगा जाएगा. Sir, I must tell you what institute is going through this phase at this time under your leadership it is unparalleled in the history of All India Institute. The kind of expansion projects being undertaken at this time in this institute has never been seen before, as you are aware. We'll talk more about it during our convocation, but you are very well aware that we are already coming up with expanding the hostel facilities. We are expanding surgical center, surgical services, mother and child services, OPD services, the geriatric facility, emergency and diagnostic block which will come up at the Masjid Mot area. Sir, as you are aware that the Delhi Development Authority has allotted 15 acres of land to All India Institute, on which we are envisioning to bring up expansion of trauma center, also a digestive disease center, ENT center, spine center, transplant center, and recently we have received a proposal for having something for diabetes and many others. And we'll also expand research space at this institute, which has been a constraint for all these years. We are also moving into redeveloping our western campus and Ayurvigyan Nagar for bringing up accommodation for our faculty and other staff, which has been a real problem for us. With the expansion of faculty, with the expansion of residents, with the expansion of nurses and other staff, the accommodation is a real crunch on this campus. Under your leadership, sir, we have been able to establish A.I.M.S Endowment Fund, which has become functional now. I am also glad to share with all of you that we have established 2 Infosys chairs by generous donation from Infosys Foundation, one in cancer, another one is gynecology, which we have announced and will be soon working on that. Sir, I'll also inform you that the number of foreign universities are keen to undergo MOU with All India Institute in various fields. To name a few, from Australia, University of Sydney has approached us to have an MOU. We'll be doing it soon. The Japan, we are already working with Osaka University. We had just concluded as a curtain raiser workshop before this Diamond Jubilee celebrations begin today on mutually agreed upon areas to develop low-cost devices and instruments, and the team has just returned last night. We also have been working with some Dutch universities, A.I.I.M.S, UK, and number of universities from USA like Michigan, Iowa, Shock Trauma Center, Baltimore, Emory University, and many more wish to collaborate with us in various fields. I am also, sir, happy to share that we are going to give the awards for research, good research work at A.I.M.S, which you will be giving to the awardees. And research section has been making significant progress over last 2 years, and now under the leadership of Professor Acharya, where the proceedings of ethics committee, which involves a lot of paperwork, has been computerized. And also anti-plagiarism software we have put in place, which anybody, any of the faculty, residents, students, research scientists can use to avoid embarrassment for themselves or for the institution, which is every journal now scans any article submitted for any plagiarism or copying of the material. Very lately, sir, we have also begun suo moto, we have taken quality improvement program at All India Institute, which I think every hospital, every healthcare facility must do that by way of internal audit, external audit, and also some watchdogs who are not directly related to patient care and other services. This quality improvement program, I am happy to share with you, sir, that our faculty has shown great enthusiasm, and now we have already held 2 workshops, and the 3rd workshop will be on Saturday for this purpose, and already shown some significant improvements in reducing the waiting times, in reducing the resuscitation times, and many other areas which we will auditing by way of this quality improvement program at All India Institute. Professor Devrari from Pediatrics has been leading this program and has gathered teams and formed teams from all the centers, all the departments, and we will not leave any stone unturned to make this place more friendly for the patients, as yourself has focused this by computerization, by online appointment system, which is in progress and will be soon submitting you what we have been able to do so far. We cannot overemphasize the importance of cleanliness in the community, on the campus, in the residential areas, in the hospital, because hospital has certain areas like high risk areas, medium risk areas, low risk areas, and we all the time dealing with lot of microbes here. So the cleanliness cannot be overemphasized in context of a hospital, and we have undertaken this task to make Institute Day theme as Be Clean, Be Healthy. And we invited the logo for this theme, and I am share with you that we got many suggestions, and we selected one of them, the committee selected one of them, which has been accepted. We also advertised on web to get a logo for our the Diamond Jubilee year, and we got a lot of suggestions and designs, and we have selected one of them which you will be unveiling today. What we want with some speed is the resolution of our residential accommodation problem for faculty and all the staff, which you are already aware. You were very kindly written to the finance minister to allocate some houses in Kidwai Nagar, which we will like to be pushed further, that we get those houses in the interim. With these words, I again thank you, sir, for sparing your time out of a busy schedule. I know that you are too much preoccupied, and gracing this occasion as the A.I.M.S president. Thank you very much.
Thank you so much, sir, for appraising the audience about the latest developments which are happening on A.I.M.S campus. Now it's the time for the awards distribution ceremony, the A.I.M.S Excellence in Research Awards 2014 and 15. I would like to call Professor Pramod Garg, Sub-Dean Research, to conduct the ceremony for the Research Awards.
Thank you, Amit. Honorable Minister Shri J.P. Nadda ji, Honorable Director Professor Mishra, Professor Aaron, Dean Academics, Professor Acharya, Dean Research, Professor Karbanda, dignitaries in the hall, senior faculty members, ladies and gentlemen. It's my privilege to introduce and announce the A.I.M.S Research Awards for the year 2014 and 15. So these awards were introduced in 2012 to recognize excellence in research, encourage faculty and scientists, and inspire young researchers. We have 2 categories of awards in basic science and clinical sciences, and we gave 1 award, first prize in both categories, and second prize, 2 second prizes in both the categories, and then third prize and certificate of excellence. The selection process involves a screening committee, which comprises of Dean Research, eminent faculty from the institution, and finally, there's a award committee under the chairmanship of director, and it includes external experts from outside the institute. The criteria that we take into account include novelty, methodology of the study, translational value, and ultimately impact on patient care. This year, we received 48 applications for consideration in the award category, and total 6 awards in basic science category and 9 awards in clinical science categories are being presented. May I request the Honorable Minister, please, and Director Sir and Dean Research to please come forward and present the awards. The first prize, I'm happy to announce, goes in the clinical category to Dr. Kameshwar Prasad, who is the Professor and Head of Neurology, for his work on intravenous autologous bone marrow mononuclear stem cell therapy, for ischemic stroke, a multi-center randomized trial. Professor Kameshwar Prasad, if he's here, sir, you could come for, or any of the member who is a co-investigator from his team. Okay, sir. So this work was a first randomized control trial of 127 patients. It was, the design and execution was impeccable and showed no benefit, but it itself was a very important study, and even negative results here were significant. So this was the, all the members of both the committees actually rated this as the first most important work. The second prize in the clinical category goes to Dr. Rakesh Lodha, Additional Professor, Department of Pediatrics. Dr. Lodha, if you could come please. This is pharmacokinetics of isoniazid, rifampicin, pyrazinamide, and ethambutol in Indian children. This was an important study in pediatric patients who are malnourished and well-nourished, and it has very important translational value. So congratulations, Dr. Lodha. The next second prize under the clinical category goes to Dr. Somesh Gupta, who is Additional Professor in the Department of Dermatology. This is intralesional injection of Mycobacterium W vaccine versus Imicumod 5% cream in patients with anogenital warts, a randomized trial published in a good journal, novel therapy for mycobacterial vaccine here in difficult to treat anogenital warts, and should prove to be useful in clinical practice. Congratulations, Dr. Gupta. The second prize in the basic category goes to Dr. Sharmishta Day, Assistant Professor, Department of Biophysics, for her work on synthesis and biological evaluation of novel peptide BF2 as an antibacterial agent against clinical isolates of vancomycin-resistant enterococci. As we all know, drug-resistant bacterial infections is a global problem, and her work relates to drug discovery of a synthetic compound. Congratulations, Dr. Dave, to you. The second prize in the basic category goes to Dr. T.C. Nag, Professor, Department of Anatomy, for differential effects of prenatal chronic high decibel noise and music exposure on the excitatory and inhibitory synaptic components of the auditory cortex analog in developing chicks. This was a model of auditory development in chick embryos, and it's a very important model, and congratulations to you. The third prize in the clinical category goes to Dr. Nupur Gupta, Assistant Professor, Department of Ophthalmology, RP Center, for her work on prevalence of corneal diseases in rural Indian population, the corneal opacity rural epidemiology study. This is an important cause for blindness in India, and it is a very important epidemiological work and should help plan policy for treatment and prevention of blindness in India. Congratulations to you. The next prize goes to Dr. A.I.I.M.S. Prasad, Professor, Department of Surgery, for his work on symptomatic outcome following laparoscopic Heller's myectomy in cardiomyectomy in patients with ecclesia cardia. This is a randomized control trial, and the result should help decide the appropriate technique for repair and better outcome. If Dr. A.I.I.M.S. Prasad is not here, anybody who is a co-investigator could come and collect the prize on his behalf. Okay. The third prize in the basic category goes to Dr. Kunjang Chosdal, Professor, Department of Biochemistry, a combined gene signature of hypoxia and notch pathway in human glioblastoma and its prognostic relevance. This work deciphers molecular pathways of glioblastoma and may help find a new and better chemotherapeutic target. Congratulations to you, Dr. Chosdal. The next third prize in the basic category goes to Dr. A.K. Dinda, who is a Professor, Department of Pathology, a comparative study on renal biopsy before and after calcineurin inhibitor therapy, an insight for pathogenesis of its toxicity. Renal toxicity, of course, is a major side effect of many drugs, and this should help understand its pathogenesis and ultimately prevention. Congratulations, Dr. Dinda. Certificate of commendation goes in the basic category to Dr. Jagriti Bhatia, Additional Professor, Department of Pharmacology, for her work on telmisartan ameliorates cisplatin-induced nephrotoxicity by inhibiting MAP kinase-mediated inflammation and apoptosis. Congratulations, Dr. Bhatia. This work should help reduce the toxicity of certain nephrotoxic drugs. Next award goes to Dr. D.N. Rao, Professor and Head of Biochemistry, for his work on evaluation of multiple antigenic peptide based on the chikungunya E2 protein for improved serological diagnosis of infection, and his work should pave way for an indigenous kit for diagnosing this infection. Congratulations, Dr. Rao. Next award goes to Dr. Rashna Meel in the clinical category, Assistant Professor, Department of Ophthalmology, RP Center, randomized control trial in Group C and D retinoblastoma, important randomized control trial which show that some of these patients can be benefited with chemotherapy. Congratulations, Dr. Rashna Meel. The next prize goes to Dr. C.S. Bal, Professor and Head of Nuclear Medicine, for his work on lutetium EDTMP for palliation of pain from bone metastasis in patients with prostate and breast cancer, a phase 2 study. This also has very important translational value in patients with metastasis to the bone. Congratulations, Dr. Bal. Next prize goes to Dr. Rashmi Ramchandran, Additional Professor, Department of Anesthesia and Critical Care. This work is on endotracheal intubation with intubation, laryngeal mask, airway, C-track and COBRA PLA in simulated cervical spine injury, a comparative study. And again, this work is important from the point of view of patient care, and this is a good randomized trial. Next prize go to Dr. Vinay Gupta, Additional Professor of Ophthalmology, RP Center, on his work of risk of perimetric blindness among juvenile glaucoma patients. And again, it has important implications for patients with juvenile onset glaucoma. So congratulations, all the awardees. I must say that this year we received many applications. Thank you, sir, very much for the awards. Amit, you can announce the next one.
Thank you, sir. So we have more award ceremonies, so I request you. तो इससे पहले दूसरे अवार्ड्स के लिए जाएं, एक विशेष अवार्ड हमारे हिंदी प्रभाग देता है वार्षिक हिंदी डिक्टेशन प्रतियोगिता वर्ष 2014-15 में ये अवार्ड हमारे अपने निदेशक प्रोफेसर MC मिश्रा को मिलता है। मैं चाहूँगा अध्यक्ष महोदय प्रोफेसर मिश्रा को हिंदी डिक्टेशन अवार्ड इस साल का दें। For the other awards for undergraduate, postgraduate, PhD scholars and staff, I'd request Dr. Professor V.K. Bansal, who is Subdean Academics, to announce the awards.
Thank you. The awards in the various categories for the students, basically the undergraduate, postgraduate students and the senior residents. The first award, Shri Mohanlal Vig Medal 2014 for clinical research, Neha Rai. She gets 2 awards. The other award is Manohar Lal Soni Book Prize Award 2014 in Neurology for the best postgraduate student also, Dr. Neha Rai. Dr. B.K. Anand Medal 2014 in Physiology for the best postgraduate student, Dr. Surya Prakash M. Dr. Bodhraj Sabarwal Medal 2014 in Ophthalmology for the best postgraduate student, Shreyas T.S. The next award, Colonel G.C. Tandon Medal 2014 in Anesthesiology for the best senior resident, Ajisha. G.C. Tandon Medal 2014 in Anesthesiology for the best senior resident, Ajisha. Dr. Atam Prakash Medal 2014 in Surgery for the best intern, MBBS, Ravi Sharma, Dr. Ravi Sharma. Dr. Sham Sharma Medal 2014 in Radiology for the best postgraduate student, Ankita Agarwal. Dr. Sham Sharma Medal 2014 in Radiology for the best post Ankita Agarwal. Dr. Jagdish Lal Kapila Medal 2014 in Cardiology for the best postgraduate student Vikas Thakran. Professor H.D. Tandon Medal 2014 in Pathology for the best postgraduate student Shubham Agarwal. Dr. V. Ramalinga Swamy Medal 2014 for best junior resident in pathology Dr. S. Madhu Rajeshwari. Mrs. Geeta Mittal Medal and Book Prize 2014 for Basic Research, Salma Malik. Mrs. Geeta Mittal Medal and Book Prize 2014 for Basic Research, Salma Malik. Dr. S.V. Talekar Medal 2014 in Biophysics for the best postgraduate student, Avinash Singh. Shrimati Lilavati Salwan Book Prize Award 2014 in Obstetrics and Gynecology for the best junior resident for an outstanding research, Shikha Bhatwal. Professor V. Hingorani Medal 2014 in Obstetrics and Gynecology for the clinical resident, Shikha Bhatwal. Okay. Dr. K.C. Kandhari Book Prize Award 2014 in Dermatology and Venerology for the best postgraduate student, Riti Bhatia. Sorrel Catherine Freeman Book Prize Award 2014 in Pediatrics for the best postgraduate student, Priyanka Madan. Sorrel Catherine Freeman Book Prize, same award for in Pediatrics 2014, shared between Vijay Ji also. Kamini Charity Trust Book Prize Award 2014 in Otolaryngology for the best MS ENT student, Padmavati Krishnamurthy. A.I.M.S of America Book Prize Award 2014 for the best nurse, Govindi Chauhan, which has been shared by Suresh Chand Nagi. Also, the A.I.M.S of America Book Prize Award for the best nurse, Suresh Chand Sangi. The next prize is A.I.M.S of America Book Prize Award 2014 for the best nurse in research work, Sudha Lama. Which has been also shared by Nisha Thomas, the A.I.M.S of America Book Prize for Best Nurse in Clinical in Research Work by Nisha Thomas. The A.I.M.S of America Book Prize Award 2014 for Best Nurse in Community Care Nursing, Amit Kumar Gupta. The first prize in the 60th Institute Day Logo competition Dr. Kharbanda, please announce that.
And good afternoon. To celebrate the commemoration of 60 years of All India Institute of Medical Sciences towards excellent contribution in patient care, medical education and research, a logo design and tagline competition was arranged. Through this competition, 80 entries were received from various parts of the country. On the occasion of launch of Diamond Jubilee celebration, the winner and runner-up of this competition are being facilitated. May I request Honorable Health Minister Shri J.P. Nadda ji and the dignitaries to please unveil the logo. I will also request Honorable Minister to please unveil or inaugurate the description of the logo, which I will be speaking later. The description of the logo is as under. The 60 years of A.I.M.S is depicted by a concept of 6 and 0 with 2 additional arms which complete the trinity of mission of A.I.M.S, that is patient care, education and research. The logo concept is based on the color code of Indian national flag. The green colored circle is suggestive of 0 of 60 years. The circle houses A.I.I.M.S logo in blue. May I request now the President A.I.M.S, Shri J.P. Nadda ji, to please give awards to the winner of this logo, which is designed by Kushendra Kumar Shukla. The runner-up for this logo is Mr. Dinesh Singh. It is a coincidence that Dinesh Singh's logo has been second last year as well as this year. It is. Thank you, sir.
Yeah, I just request the President for 1 second. Professor Kameshwar Prasad is here to receive the award for the best research work. Professor Kameshwar Prasad. Thank you so much, sir. It's now time for the A.I.M.S Silver Jubilee Oration. I would like to invite Professor Balram Aaron, Dean Academics, All India Institute of Medical Sciences, to introduce the speaker and invite him for the A.I.M.S Silver Jubilee Oration.
Thank you, Amit. Honorable Minister of Health and Family Welfare, Government of India, and the President A.I.M.S, Shri J.P. Nadda ji, respected Director, Professor M.C. Mishra, Dean Research, Professor S.K. Acharya, Chief CMAT, Professor O.P. Kharbanda, Professor V.K. Bansal, Sub-Dean Academics, Dr. Sanjeev Lalwani, Registrar Academics, Dr. Raja Sabapathy, distinguished invitees, dear colleagues, ladies and gentlemen, it is my pleasure to introduce to you A.I.M.S Silver Jubilee Oration and its orator, Dr. Raja Sabapathy. The Institute awards an oration to an eminent scientist from India or abroad, which is named the Silver Jubilee Oration Award. This award is given to an eminent person for his outstanding contribution in the field of medical or related sciences. This award carries a prize of rupees 10,000 and a plaque. For the selection of an orator, nominations are invited from the heads of the institutions of learning, vice chancellors of the universities, directors of research institutes, deans of faculty of medical sciences, directors of medical education of the states, and other persons of eminence that the institute may think appropriate. The orator is finalized by a panel of experts chaired by the director A.I.M.S, and he is invited to deliver the oration on a subject of his choice. The orations in the past have been delivered by distinct faculty, including Professor A.S. Pental, Professor M.S. Valyathan, Dr. C.S. Ranawat, Professor Joseph C. Mental, and others. This year, Dr. Raja Sabapathy will deliver this prestigious oration. Dr. Sabapathy graduated from the Stanley Medical College, Madras as the best outgoing student, standing first in the university in medicine and surgery. He counts himself fortunate in having many great men like Professor Sarat Chandra, Dr. Ravi Kumar, Professor Venkat Swamy, Mr. Bruce Bailey, and Dr. Harold Leonard as his teachers and the mentors. In addition to teaching the surgical skills, they also taught him the skills in setting up a department and leading a dynamic team. This helped him to introduce reconstructive microsurgery to this region of the world in 1991 and build up a world-renowned institution. His core interests and strengths have been in the field of hand surgery and reconstructive microsurgery, and has built up a very busy hand injury and replantation services. He was instrumental in starting the work in the fields of brachial plexus, surgery in paralytic disorders, and wrist surgery in the region. The work done resulted in the invitation to him to deliver the Douglas Lamb Lecture at the British Society of Surgery of the Hand and visiting professorship to many universities in India and abroad, including USA, Singapore, Malaysia, Sri Lanka, and Bangladesh. He has authored numerous publications, book chapters, and feels privileged to have been associated with Professor Robert Eklund in bringing out the practical manual of microvascular surgery. Presently, he is leading a team in the setting up of a diabetic foot care unit and a center for burns. And he is the chairman of the Department of Plastic, Hand and Reconstructive Microsurgery and Burns and Maxillofacial Surgery at Ganga Medical Center and Hospitals Privately Limited, Coimbatore. He has also taken keen interest in administration and has been the president of the Association of the Plastic Surgeons of India, Indian Society for Surgery of the Hand, Indian Society for Reconstructive Microsurgery, Brachial Plexus Surgery, Government of India, and International Trauma Center, India chapter. Ladies and gentlemen, it is my privilege to invite Dr. Sabapathy to deliver the 21st A.I.M.S Silver Jubilee Oration. Dr. Sabapathy, please. Thank you. May I please request all the dignitaries on dais to go down to hear the oration, please.
There is a projection there, sir. There is a projection there.
Okay, sir, we'll projection here. Thank you.
Honorable Minister for Health, Dr. Naddaji, esteemed Director of All India Institute of Medical Sciences, Deans and distinguished faculty, and the awardees who got the prizes this morning, and ladies and gentlemen. At the outset, it gives me great pleasure to be here, and I profusely thank Professor Mishra and the faculty of A.I.M.S for giving me this opportunity. While I consider it as an honor, I also think it's a part of the responsibility so that I come up and justify the reputation and justify the trust that they have placed in me. I have chosen the topic as nation building with reconstructive surgery. I think I need to explain why I chose this topic. If you would Google this word nation building, you will find a lot of meaning. The title will range from, the meaning will range from helping reconstruction a nation in the aftermath of a war to the point of building an identity for a nation. I think how I chose this topic was when I was doing my college, when I used to read about our freedom struggle and how India became in India from the colonial rule, and the part of the professionals and the industrialists. I think Jamshedji Tata, when he started the Indian Institute of Science, which was thought about much ahead of its time, he just told the word, nation building is our business. I think this clarion call still exists today. 150 years later, you will find, last year's on Teachers' Day, I think our Honorable Prime Minister told these words. That is, nation building should become a national movement, and every individual should be associated with it. He particularly said, he called for the professionals and said, if all the professionals get involved, we will go very far. And he also felt that there's no adverse situation can come in the way of a determined individual in the part of a nation building. So the scope of the talk is this. The task of developing a psychic, a terminology, and then a physical space that we identify as India. I think if all of us put our conscious effort to it, I'm sure it will be a great aim. We all can make a big difference because as doctors, we aim at the very foundation on which the nation stands, at the health of the people. I think that's what now we are dealing with this. Some time back, we had a very senior I.A.I.S. officer visiting our institution. And then he addressed the staff of our hospital. And then he asked the client question, he said, what is India? And he said, India is you, and then me. I think all of us form part of India. And he said that each of us, if we do well, I think India does well. And if each of us help another person to do well, then India does better. I think that's what is the thing. I think I'm basing this talk on these same models. And I am a reconstructive surgeon. I think I love the job that I do. I think the feeling that we do is that every morning when we go to work, I have a great feeling. That means we are going to be playing a significant part in someone's life. I think that's what we do. I think we are reconstructing lives of individuals. And every individual reconstruct, we are reconstructing a family. And in that part of it, we play a great part in the nation building. I'll start with 3 examples as to what we do every day. I think here you see a 12-year-old girl who was just playing in a village festival. The hair gets caught in a giant flywheel. And then the whole of the scalp comes off. I think the whole scalp, the eyebrows, eyelids, and both the ears come off. I think this is a real problem. I think when the mother came and then he said, one of the questions that the mother had was this, will she ever get married? I think this is the one which is the result after the microsurgical replantation of the scalp. And then the answer to the question what the mother had that day was answered 9 years later when she came back with the wedding invitation. I think we're just not reconstructing the scalp. I think we are reconstructing a family. I think in this way we form a great role in national building. Next we take about trauma. Here is a computer engineer, I think, who stands first in his college and then takes up a job in a multinational company. I think while returning from Bangalore to his native place in Kerala, I think in a bus accident he gets injured. I think this is not just the injuries he had. It's not the soft tissue injuries that he had. In addition to that, he had a fracture of the mandible, he had a face and also extensive loss of the bone, and he arrives intubated. I think the chances of him getting both legs amputated looms large, but then with the available techniques that we have, or the microsurgical techniques that we have, we can cover up all the defects that we have with the level of bone transport, and later on, at 18 months, you find that he's just walking. But it's not just that walking that we have. And then he really said, he sent us a photograph after some years, he said, sir, what you did, I think if you had not made me walk, I think I would not have achieved this. He sent again his wedding invitation. And then it's a family. So what we have done is, it's just not that we have given him legs. We have seen to that the skill levels that he developed in his college has not got wasted. We have sustained his career and we have kept his family intact. And the third example I'm going to give you is this of a young girl who has got a small burn injury. The injury may be small, it's a small injury, it affects the hands and a part of the face. But then the thumbs no longer meet the fingers. That means the child doesn't write. Okay, this is the part, and then after this, what we do is that this child just goes back. This child goes back and starts going to the school. And then when we say that the child has gone back to the school, it's not that now he has gone back to the school. We need to look at the larger picture as what we have done. I think what we look at is that we have made the child as a future educated mother. I think these are the three examples with which I am going to start, and then the whole of the talk stems from the experience that we have gained in the last 25 years. We started out in 1991 when the institution was small with 35 beds, and we had 4 operating rooms. And in the year 2013, we rose up to a stage of now 480 beds with 22 operating rooms. In the plastic surgery department, in the year 2014, we did 10,500 surgical procedures. And totally with the orthopedics department, the trauma-related procedures alone, we had 16,500 trauma-related procedures. But then as the logo stands, I think there is a Charles Mayo. I think the founder of the Mayo Clinic, he said there are twin aims of medical education. One is the patient care, other is the advance the science. And then where is the advancement of the science, I think we need to teaching and training is parts important law. And then we get 100 surgeons a year visiting us every year. I think last year we had 132 surgeons visit us here. And then there are certain principles which have guided us in our work every day. And then that's what I am going to do. In the Thought of a Nation building, Jeremy Suri, I think is a professor in Austin, in public affairs, he said nation building, there are 5 things in nation building. There is the 5 P's he said in nation building. There is one is people, purpose, process, and problem solving and partners. I think these 5. I'm going to talk on this oration on these based on these 5 points. The first is the people. I think most important is that in the people there are 2 things. One is what is called as the skill set, other is the attitude set. I think the skill set is the lesser of the importance because now I am fairly convinced with the amount of technical services that are possible, I think we can always develop the skill sets. But then there is no easy way out, but there is a definite way out. As Malcolm Gladwell said in his Outliers book, if somebody puts up 10,000 hours of work in a particular field, I'm sure he is going to do well. And then attitude matters. I think what really matters is that more than the skills, I think what really matters is attitude. Close to retirement, I think all of us know Sachin Tendulkar. Close to retirement, when somebody asked him what does he feel about playing cricket, he said, I only think of playing good cricket and nothing else. The hunger for runs is the same today as when I started. I think with that idea, he carried India on his shoulders. This is the same with every top playing individual. Joe Magid, D. Magid is a New York Yankees, the famous baseball player. And they asked him, I think, how is that you are continuously playing like this? He said, every time when I step into the field, I think of this. He said, there is always one player, some kid who may be seeing me for the first time. I think to him I owe my best. I think with that I step into the field. I think that's very important. So if as doctors, if we step into the field, I think every time we operate, I think I'm a trauma surgeon. I think every time I operate, I think if I have to think, when I start debriding, I think every time I should think, here we must achieve primary healing, then there must be no infection. You just keep on telling that as you scrub. I'm sure what really happens is that subconsciously you've taken a lot of effort to see that it doesn't really happen. If we have to do that in medicine, I think we need to see the larger picture in everything that we do. I think this is very, very important. I think larger picture in seeing everything that we do. For example, if this child who arrives in the evening in the night time, a 10-year-old girl who arrives here, I think it's a major crush injury. The clamp that you see shows that the vessel has been damaged. It's a devascularized hand, open fracture, median nerve is injured. And then if we have to do that, starting the surgery at 11 p.m., on the left side I have put what we have to do. I think child needs resuscitation, radical debridement, vessel repair, bone fixation. And then you need to do another 3 hours of operation to cover it. I think how do you sustain doing this? I think if you just think of what you are going to do as a technical part, I think you cannot do this. But then if you really think this way, that means we are going to give back the right arm of a 10-year-old child. That means this child is grow up as going to be a nice girl. I think this family is going to be happy with us. I think if you take a larger picture of what we are thinking, what you are doing, then you will be able to sustain your work day in and day out. I think once we do that, I think this is the same child 2 years after with a nerve recovery. I think she's gone back to school and she's doing well. So the charm of doing in medicine is that you need to see a larger picture of everything that we do. I think in every limb that we reconstruct, I think what we say, tell our residents is that the greatest gift will be the ability to see the transformation of the nation, one patient at a time. Then you really realize now how powerful our work could be. Now this goes on to the next stage of what you call me purpose. I think we need to define the purpose of what we do in our work. I think I was very fortunate. I think I was with good people all the time. And then when we came back to the United States in 1991, at that time we didn't have much of work. Then I happened to listen to one of the lectures given by one Mr. Tulasiraj of A.I.I.M.S hospitals. I think that was a great, important lecture that I listened. And Andy Grove, the Intel's co-founder, says sometimes an inflection point. That is, sometimes an event that changes the way you think and act. And then from a very humble beginning of 12 beds in 1978 to the most leading eye care provider of the world, even by 1991, I think the A.I.I.M.S hospital had grown. And presently they do about 250,000 surgeries per year. And 60% of them, they were doing it free. And then how did they get this power? I think the most important is that they said they defined their purpose. The purpose was preventing needless blindness. I think that gave me a thought. I said, no, you need to define your purpose. I think they defined their purpose and relentlessly chase the purpose no matter what. I think that's very important. I think you relentlessly chase your purpose no matter what. But the first thing is that you need to articulate your purpose. So that day we went back and then we started articulating our purpose. I think we articulated our purpose as preventing needless deformity following trauma. I think that's the purpose we did. And then we didn't feel shy about it. Even if you find the last year's our activity report of our unit, on the back wrapper of this we put contributing to nation building. We don't feel shy about it. I think we think so. I think we firmly believe it. Contributing to nation building by changing lives. I think one patient at a time. I think once you strongly believe it, I think that's true. I think this value is universal. I think I was working with Dr. Harold Kleinet. I think the first person who ever repaired an artery of 1 millimeter in diameter. I think when I was coming back home, he said, I'll give you, you always know, you always be asking advices. And then he just said, Raja, that what you have to do is that if you love hand surgery and keep doing good hand surgery, he said everything will take care of itself. And when I said I need to start in a trauma unit, a hand injury unit, he said, the most important three things, he said 3 A's, he said. He said the first A is availability. No matter how good you are, I think if a person comes injured, you have to be there. I think the first thing is availability. Second thing is that he said affability. I think you have to be nice to the people. I think that's the second thing he said. And the third thing he said is ability. And he said, I mean it's in the same order. I think it's not the ability that counts first. I think what he said was that in trauma, the most important is availability. Next is affability. Third is ability. And to that we added one more A, and that is in the fourth, when we started the unit, affordability. I think that's what which makes possible. I think when I was talking about the power of the good purpose, I think I realized it in 2012, a few years back. Sometime back, we are while traveling in a flight, I think a Rotary Club president was sitting next to me. He was just asking, we wanted a good project. I told him, we shouldn't start a small project. I think we should start a big project. Then I told him we should start a big project for treating burn deformities. He really didn't understand what that involved, but then he said, okay, doctor, we'll do that. I said we should do it totally free, irrespective of the complexity of the problem, the number of stages it might take, or the time that is involved. So again, we said, we'll write down the purpose. I think you need to write like a business plan. I think you need to write down the purpose. I think we wrote down the purpose as preventing needless disability due to burns by reconstructive surgery. I think that is the purpose we did. But then what did this project achieve? I think here you see a child. It's an 11 months old child who accidentally put both hands into hot water, and then the child, both the hands get deformed. Just imagine a child growing up like this with both hands getting deformed. I think that means it's a big disaster. That's one hand, that's the other hand. And then what we did was that by reconstructive surgery, the child again starts using his hand. But now the child goes back to school. I think now we think we are getting a useful citizen back to the country. I think 3 years since we started, we have done a total value of the project was more than 1 crore. We never thought the money would come. But then the money kept pouring. As surgeons, we operated free, but then the Rotary takes care of the materials that are involved. Then we frequently organized beneficiary meetings. With every beneficiary meeting, donors bring in heart-rending stories, and the project sustains. So the value of this project so far has been 1 crore, and we have got definite pledges for another 1 crore. The only thing is that they said, doctor, please keep doing this. I think that means, again, I understood the power of a good purpose. I think what is really important is that we need to have a power of a good purpose. That's what is very important. Later on, I think if you really start talking about power, I think long back a father of our nation, Mahatma Gandhi, has said, taking on an idea which is beyond your capability has a powerful side effect. It finds you, helps you find allies everywhere. I think a lot of people are going to help you if you've got a good purpose. So what is really important is that now you need a trust capital. I think just before this meeting, I think I was speaking in the director's room, what he said was a reputation capital and the trust capital that A.I.M.S has. I think our director was talking about it. I think that's very, very important. Even when this project is being proposed in the Executive Council, I think Rotary, I think the only thing on which they agreed was that it was the trust capital of our institution. I think we need to clear the trust deficit when the paper and the project is proposed. And this trust is generated not in a single day, it's generated by one step by step, patient by patient, day by day, year after year. I think that's what sustains. I think we need to build, I think we all look up from Coimbatore down south and we look up at A.I.M.S. I think we need to build up institutions with reputation capital so that the people have got a lot of trust in this. I think it is very, very extremely essential for doing anything that is of significant of value. Now we come up to the third thing, processes. I think we have finished people and then we have talked about this thing. Then now we talk about processes. In the World Economic Forum in Davos, I think a few years back, I think Bill Gates, he said when he spoke, he said there are two great forces in this world. One is that first is self-care. I think everyone wants to be sure that they have to be all right. And then when that is guaranteed, then they start looking at now how can we help others, I think caring for others. And then somebody asked him, how does he spend his dollars? I think, where does he want to donate? I think, how does he choose projects? He just used a very nice word. He said, we must address market failures. I think he also said, I think what we need to do is that of catalytic philanthropy. I think that's very, very nice words he used. I think I'll say what you mean by market failures and what he said. So here you see a patient. I think I'm going back to the same project which we did. I think here's a boy, I think the right side was his normal face and that's what his face has become after a burns injury. I think he was injured while making tea while doing lunchtime at in Ooty. But then once this happened, he was too scared to come out. I think people ran off and seeing him and lived for a year like that till our project gave hope, and that was his right hand. So his face gone and his right hand gone. I think the mother was the only person who saw him after he got deformed. But then with the project, I think he's the same person who is now here. Now he works as a security person and then he makes a living. I think we are giving him back a useful life. But how do they fall out of a radar of a healthcare system? I think that's the point. I think what really happens is that some problem happens, but then a stage reaches when they can't go to the hospital. I think because with this stage, you can't go to the hospital. Even when he came to our hospital, I think he came in the middle of the night, like a terrorist, that is completely covered. I think that's the way they can come, otherwise they can't come. They can't be coming to the hospital again and again for admission. I think when they come to the hospital, they have to be admitted. I think that's it. So these are small things which really make it to this thing. But what really happens is that if you see in any healthcare system, I think it's a loop. I think sometimes the loop doesn't get completed. I think inability to complete the loop in healthcare system, I think that's the problem. I think this is not the problem of India alone. I think even if you go to United States, the same thing exists. I think inability to complete the loop. But the thing is that each of us can contribute to make this loop complete. I think that's the point. I think each of us can make this loop complete. And even a project like this, what we said, helps us complete the loop. I'm telling you about the process again. I think I'll give another example. So here you see a lady who has knee joints have got bent. I think he has been living like this for 2 years. That means she has never walked for 2 years. In the 2 years that she has not worked, imagine what happens to the family. I think but between the first slide and the right side, the slide on the left and the slide on the right, there is 5 months of treatment, 5 months of hard work that goes in. After 2 months, I think she comes up to the stage. I think after 2.5 months, we have to stretch the legs because the vessels have got shortened. I think after 2 months, it comes up. 2 to 3 weeks of intense physiotherapy, so much of hard work that goes in. After that, now she comes up to a stage where it doesn't require so much of attention. Now there are 2 therapists, and you find a couple of weeks later, there's only 1 therapist is required. After that, now she doesn't require a therapist. I think she walks alone. But then she requires a little bit of assistance, and after that, now she requires no assistance. But then this takes her 5 years. But then it takes about 5 months to do this. It takes about 5 months to do this. But then, if you don't complete the process, that means it's gone. I think what really happens is that I think we need to complete the process. I think only then, I think we can build up the grades. But what I am giving a call is there are a lot of young awardees in this house, in this room. I think what really each one of them have to get convinced is that each of us can try to make this student complete, and it is more a matter of attitude than that of resources. I think that's the main thing that you do. The most important thing is that you need to take ownership of the problems. I think there's a nice word I have listened. I think we have made this use, used it many a time. That is said, the city you live must be the best in the world. If not, you are also part of the problem. I think that's a very nice saying that is there. And then you can also do something about it. What I tell every time somebody joins in our hospital, I tell them, I think you must consider that Ganga is the best hospital in the world. Otherwise, you are also part of the problem. I think all of us start thinking, I think if you sit in A.I.M.S, I think you sit in any hospital, any institution that you work, I think you have to think that this is the best in the world. Otherwise, you are also part of the problem. I think if each of us take ownership of what we are working, I think it should be done. I think this is a partner which we tell to every one of us who join every day. My advice also to our staff before complaining about a problem. I think there are so many problems. We have 1,500 people working with us. And there are so many problems that come up. I always tell them, whenever you are faced with a problem, before complaining, just please ask yourself whether if you can do something about it. I think you just ask that question, and then after that, please complain. Okay, and then you will really find, but then when they ask that question, most of the times they don't need to complain. I think many a time that problem could be solved with it. The commonly attributed reasons is that you always say there's more work, more patience, more time, less time, all these things are there. But then what we really need to have is that we need to convert these disabilities into opportunities. In the latest book of Malcolm Gladwell, I think he put in a book, nice book, is David and Goliath. I think what he has written, a nice word, he said, we need to look at these things as desirable difficulties. I think it's a very nice word. He said, he used the word of desirable difficulties so that you can convert them into glorious opportunities. I think that's a very nice word. But then, so many decades back, our philosopher, President of India, I think former President of India, Radhakrishnan, has said this, our life is a mixture of necessity and freedom and chance and choice. We may not change events, but then we can change our approach to events. I think that's a very nice word he has said. I think that's exactly what we have done. I think this we have to do it day in and day out. You have to do this. I think I'll give an example of what we have to do this with the microsurgery training lab we do. We all have a patient overload. I think we need to think of it as a desirable difficulty because a patient overload is a teaching capital. I think it's also a clinical research capital. I think those things are two things here. But then, having a research capital or is this thing, if you don't have the process all right, I think we won't win. I think that's it. So when we started our microsurgery training lab, I think it was the first and we did the first. And then we really thought, should we do it on a smaller scale or should we do it at the world class? I think what exactly happens in America. And we thought, there's a Robert Ackland with whom we worked, he always said that the beginner needs the best. So we thought, we should do it on the big scale. So when then we did it exactly on the model, I think in fact we surpassed it. They don't have this much of patient load. So we had the patient load and we had the same amount of infrastructure which we created. The result was that we now had trainees from 51 countries coming to us. I think we had 51 countries and 118 cities from India. I think all of them have taken. So the number of surgeons who have taken part in the training lab is 727 surgeons have taken part in the lab. And the fourth part of it is problem solving. I think we need to really find it out. See, when we started our institution, I think we wanted to do replants. And then a lot of trauma patients came. And then as I analyzed all trauma patients, which I am very, very sure it still stands true, any trauma patient, whether he is a big man, is a rich man, poor man, whichever part of religion he can, I think all of them have only the three questions when they come up with accidents. The first question is that self-preservation. First question is, will I become all right? I think that's the first question. The second question is that, how long will it take? The third question is that, how much it will cost? I think these are three questions. But then I also found a common denominator. I think nobody gets injured with money in the pocket. You may be able to raise about 1 crore of rupees the next day. But then at the time when you get injured, I think you are defenseless. I think you are at the mercy of the person who is just on the street next to you. I think we wanted to do replants. And then nobody gets injured with money in the pocket, but then the replants can't wait. I think this is the dilemma that we had. And then what we decided was that, let's do it anyway. And then we found a very surprising trend. I think we tell them how much it would cost, but then we started doing it off anyway without getting anything. We found only 10% of the people didn't pay. I think some of them paid lesser, but overall didn't matter. I think with volume we made it all right. And we also kept a variable pricing. But then what is really important is that you need to get a consistent good outcomes and volume. I think it was volume. Then what really it helped us now, it helped us to build volumes. But once you build up volume, I think you become much better. The same boy, with whom you are reattached the thumb. But once you become better, with the volumes, I think you can keep on getting extending the indications. See, these are all considered to be non-replantable. I think the world said is non-replantable. But then because you had a volume, I think we devised techniques. I think even such things we replant. They don't do exactly the normal hand that does. But then this hand goes on to a very, very useful hand. This avulsion amputation. I think this was the topic of the Douglas Ram lecture at the Royal College. So every one of us can contribute to health equity. I think health equality may be difficult to obtain because health equality means it depends on so many things like genes, your place you live and all that. But health equity, I think all of us can help to develop. Healthcare inequality, I think equity can also tear a nation apart. We have to contribute to health equity and could start as very minor ideas. When I was the president of the Association of Plastic Surgeons of India, I introduced the concept of National Plastic and Reconstructive Surgery Day. It was not existent before. I just put up an empirical date. It doesn't have any significant meaning. I just put it up as July 15th. And to make it very significant, what we said was every plastic surgeon in the country will operate one case free that day. I think for one case free per day, that means it's not a big thing for us, any surgeon. And we did that. I think the result was enormous. I think throughout the country, I think everybody said what they did. In the next conference, we decorated the whole walls with every place. I said, all of you send your photographs of the patient which you did free that day. I think the whole of the conference, we put the walls were mapped up with this. It is a drop, but then it really mattered because it brings up the emotional level. I think it brings up solidarity and it brings up togetherness. And the last part of it is partners. I think if you want to build up nations, I think you need to align yourself and you need to really link up with people. It is an African proverb which really says, I think, which all of us as individuals we should do. I think as industrialists, a lot of them align together, but as professionals aligning together as doctors, I find it sometimes it's very difficult. It is said if you want to walk fast, you walk alone. But then if you want to walk far, you please walk together. I think that's very, very important. I think as professionals, I think as doctors, as medical men, I think we need to remember this. I think partnership beyond institutions is very important. I think we have been thinking about how to improve our own self. I think how to deliver more care. I think what now we are now definitely I'm very convinced is that we need to practice destination medicine. I think institutions like us, institutions like A.I.M.S, I think we all have to practice destination medicine. The most important is that a good institution must align together. I think that's very important. The good institutions, instead of competing with each other, I think we need to have, you need to use our services as a complementary. I think that's very important. 150 years ago, Mayo Clinic, I think when they started, I think here the William Mayo, the senior man, he had this on the walls of his. It is said if a man can write a better book, preach a better sermon, or make a better mousetrap than his neighbor, though he build his house in the woods, the world will make a beaten path this door. I think that was said 150 years ago. I think with travel becoming much better, I think it's much easier for us to do it now. I think what we really need to make is that we need to make institutions which are really good. So to conclude, and I think we all can easily make a great nation, but I think we need to remember the 5 Ps. Instead, if we must have a great time, and then the most important is that we need to really find out why do we exist. I think each of us, I think youngsters, I think you need to write a purpose. I think if you put your paper to pen and write it out, I think what's the purpose? And then if you have a good purpose and you relentlessly chase that purpose, I think no matter what, I am sure I will succeed. And then I always feel then God has His plans. And then in our case, God gave us a great team. I think what God gave us was a great team. And then more important than that, He gave us a loving family, I think which makes life worthwhile. Then I'll close it off with our favorite quote of my Swami Vivekananda, which he said, this is the quote which hangs it on our table, which says, take up one idea, make that one idea your life, dream of it, think of it, live on that idea. Let the brain, body, muscles, nerves, and every part of your body be full of that idea, and just leave every other idea alone. I think that's the way to success. I think if each of us follow that, I'm sure now we can make a great nation. Thank you very much.
Thank you so much, Dr. Raj Sabapati. I think standing ovation for our orator today. I request the President of A.I.M.S and Honorable Health Minister to present him with the oration plaque. Thank you so much, sir. And now I request our beloved President, Shri Jagat Prakash Nattaji, who is also the Honorable Minister for Health and Family Welfare, Government of India, to deliver his presidential address today on the occasion of the 60th Institute Day on this day. Thank you, sir.
Dr. Mishra, Director A.I.M.S, Professor S.K. Acharya, Dean Research, Professor Balram Aaron, Dean Academic, Professor Kharbanda, Chief CMET, Chiefs of Centers, faculty members, dear friends, friends from media, print media, and electronic media. It is indeed a matter of great happiness for me to be here on the 60th Institute Day of the All India Institute of Medical Sciences. After hearing the Institute Day lecture by Dr. Rajaspati ji, which was very inspiring, I think the purpose is complete. And after that, speaking is only a mere formality, because the Institute Day purpose is to inspire the students, the faculty members, to discuss how we are working in the field of health sciences and what and how we can contribute. The issues which he has raised may it be the issue of, first of all, the availability, fallibility, and the ability, the purpose, the process, and completing the loop. All these are very essential aspects of administering health sciences and medical sciences and to work for the humanity. So the lecture has been really inspiring, not only to the people who belong to the health fraternity, but it is also meaningful for people like us who come from public life and who have got a lot to contribute. And there is a purpose which we also find. And the purpose which he has explained has been certainly very path-breaking for all of us. I once again congratulate Dr. Rajaspati ji for giving his lecture, which has enthused all of us. As I said, that the purpose is complete and there's nothing more to add. But still, as the president of the institute, I have been asked to speak on this occasion. Institute Day is a very important day. Generally, in terms of when we celebrate the Institute Day, we talk in terms of how we can go where we are and how we want to proceed further. You see, any institute composes of two aspects. One is the hardware aspect and the another is the software. As far as we people are concerned, we can take care of the hardware. But as far as the software is concerned, it is because of all your contribution that we make and the institute is made. So when we talk about All India Institute of Medical Sciences, it is also an opportunity to introspect where we started from, where we wanted to go, how far we have gone, how far we have to go. You have got an excellent history, excellent record, brilliant record. And certainly, I would like to salute, I would like to congratulate all the former directors, the faculty members who have contributed to make this A.I.M.S as A.I.M.S Day. I was going through the history of All India Institute of Medical Sciences before coming. I saw that the files speak that one of the first directors, B.B. Dixit, used to write on the files, yes BBD, no BBD. This was his comment. Now this itself shows that how the director at that point of time was clear in his mind where to go and where not to go, what to do, what not to do. Administratively, how we have reached this place, all these small decisions have been very important. And so, all the legendary figures of faculty who have been associated with A.I.M.S. for the last 60 years, who have contributed their best, I must salute them, and this is a day to remember them. When we talk about Institute Day, in management there is a principle which is called a SWOT analysis. It is a time to go for a SWOT analysis. What are our strengths? What are our weaknesses? What is the opportunity? And what are the threats? As I said that I'm a person who's from the public field. And as a minister and as the president of the institute, my responsibility is to see to it that the hardware, when you talk about the Jhajjar complex, when you talk about the Kidwai Nagar complex, when you talk about the buildings, when you talk about the operation theatres, when you talk about the modern operation theatres, world-class operation theatres, all that is, the responsibility lies with me and I take care. And I assure you that we will do the best in it. And as you all know that approximately some 4,000 to 5,000 crores of investment in A.I.M.S. Delhi is being done in recent times in various aspects. But as far as the software is concerned, you are the masters. What to do in the operation theatre, how to go for excellence, what are the protocols to be followed, what direction has to be given. And I don't say, you have done a very good job. So when I talk about strengths, A.I.M.S., when I say A.I.M.S., I would not like to use the word brand name, because brand name is related to some economic world. But I'll say that A.I.M.S. in healthcare is a benchmark, which has been accepted not only nationally, internationally. It is a benchmark. And when the greatest testimony for the good work done, which is the strength of A.I.M.S., is that when the government and the people try to replicate not one but 15 A.I.M.S., this is a testimony that A.I.M.S. benchmark, which is the standard, has been accepted not only by the country but by the internationally also. So I feel that a great amount of responsibility is on our shoulders when we go for 15 more, and we are planning to open more and more. This is our strength. As Dr. Mishra was talking about the MOUs and the collaboration and the contribution of international agencies with A.I.M.S. You see, whenever we go for international cooperation, it is the A.I.M.S. as a pioneer institution which comes forward. And all the MOUs which we do, A.I.M.S. is very much in this memo of understanding, MOUs. So that itself speaks that this institute is not only nationally recognized but internationally recognized. This is our strength. The opportunity which we have is, at one point of time when our professors, our faculty members were working here, say 10 years back, 15 years back, this was the only institute where they could work. And if this was not there, they had to go outside. They had to leave the country, they have to go, because you needed a similar standards institute of similar level, which you did not have. But now there is an opportunity, because I always contradict that the coming 15 A.I.M.S., it's A.I.M.S., it's not A.I.M.S. like. It has to be like A.I.M.S. Delhi. So that is the standard we have to maintain. So now you have an opportunity. The faculty members, the students, the staff, the senior residents, and we are going to give priority accordingly. The best research work being done here and the teaching facilities which has been developed here, we would like to bring it to the other A.I.M.S. also. So there is an opportunity, and this opportunity is to be realized. When I talk about weakness, I don't know. It is the person who work, they know the best about the weaknesses. So I can only say that introspection is needed. What are the weaknesses? Because the person who is involved in the process, he only knows what are the weaknesses which we have to address. We can only say that we are there to support, to remove those weaknesses. We will be always there. I assure you that whatever the shortcomings the institute might be having, we will have to strengthen. As far as the administrative part is concerned, we understand that because of the expansion, a lot of administrative reforms are needed. We are taking care of it. But as far as the software is concerned, you know what improvement is to be done. We can only support you and see to it that we work accordingly. As I was talking about the opportunities, when we don't utilize the opportunities, it converts into threats. Those become the threats. So we have to see to it that we utilize the opportunities to the optimum. Threats are there. If in coming times the institute do not develop in time, we cannot utilize, we cannot work in the health sector in the same way, we cannot give the facilities of that very level. So that is also one aspect which has to be taken care. The government is very clear about it. The Union Government of India, Ministry of Health is very clear about it, that when we are opening these A.I.M.S, and the number is 15, which is going to increase, a lot of inputs is to be put in. We are aware of it. We will keep doing it. But at the same time, whatever the administrative reforms are needed, we are trying to develop it. Mechanism is being developed. These are the threats. But at the same time, faculty and development of faculty and departments, I think that is a responsibility which you will have to shoulder. And when you are there we are here on the Institute Day, we should shoulder this responsibility and see to it that how do we work on this aspect. I was told that you have developed a theme on the Institute Day, Swasth Rahein, Swachh Rahein, Swasth Rahein, be clean, be healthy. This is a very good concept. You all know that we have been taking the initiative of going forward by Kayakalp program, where we have kept that in a year, every year we will be having a cash prize of 5 crores for all central hospitals competition. First prize will be of 5 crores for sanitation, whichever hospital is going to keep the best standards as far as the sanitation is concerned. It has got the components of sanitation, it has got the component of reducing the infection level, it has got the component of disposal of waste management, it has got the component of housekeeping management, it has got the component of involving people for green management. So these are the components, and I think that as A.I.M.S is the best, it should also win this prize of 5 crores. And this prize is to be given every year. The second prize is of 3 crores. The third prize is of 1 crore. So you can understand what is the importance the government of Ministry of Health is giving to Kayakalp, to the cleanliness of the hospitals. And this competition is going to take place among only 13 institutions. I think A.I.M.S has got a very good opportunity, and they are working in that direction. I must also congratulate and appreciate that when I came for the exhibition, I saw that you have added one more component into it, and that is you have related health and what are the aspects to be healthy, what cleanliness has got an importance in it. So you have also associated health issue with cleanliness. That is very important aspect. कम से कम मैंने नहीं सोचा था इस एस्पेक्ट के बारे में. इस एस्पेक्ट के बारे में आपने आज मेरी दृष्टि खोली है, इसके लिए बहुत बहुत धन्यवाद. आई विल ट्राई टू सी टू इट दैट हाउ वी कैन involve, and whatever the protocols you are going to develop, we are going to see to it that that is also developed in that very perspective. And if something more can be done, certainly we'll be there to help you. Again, on the Institute Day, when I congratulate, I thank Dr. Rajaspati ji for being here with us, also for giving the inspiring lecture to us. It's a day when we should introspect and see to it that we take A.I.M.S, All India Institute of Medical Sciences, Delhi, to new heights and make it and increase the benchmark of it. That is what I can say. Thank you very much.
Thank you so much, sir, for those awe-inspiring words coming from the President himself. Thank you, sir, once again. I would now like to call upon the Registrar, Dr. Sanjeev Lalwani, to propose a vote of thanks.
Honorable Union Minister of Health and Family Welfare, Government of India, and President A.I.M.S. Shri J.P. Nadda ji, Honorable Director A.I.M.S. Professor M.C. Mishra, Dean Academic Professor Balram Aran, Dean Research Professor S.K. Acharya, Professor O.P. Kharbanda, in charge CMET, distinguished invitees, dear faculty members, students, and all the staff members of A.I.M.S. family. It is a great honor and privilege for me to be called upon to propose a vote of thanks on this occasion of 60th Institute Day celebrations. We are extremely thankful to our Honorable Union Minister of Health and Family Welfare, Government of India, Shri J.P. Nadda ji, for being with us on this occasion. Your gracious presence, sir, in today's function is of great source of inspiration for all of us, and it is indication of Government of India's deep commitment for preventive and promotional aspects of health. Thank you very much, sir, for being with us today. We assure you, sir, that A.I.M.S. New Delhi will always be at the forefront to meet any challenge that may arise on any health-related issue at any given point of time. We also express our sincere thanks to Dr. S. Raja Sapapati who has agreed to deliver this 21st A.I.M.S. Silver Jubilee oration today at A.I.M.S. New Delhi. We feel honored by your presence, sir. Thank you very much. We also take this opportunity to convey our sincere and heartfelt thanks to our Honorable Director, Professor M.C. Mishra, for his stewardship, vision, and continuous guidance, which has given us impetus in organizing this Institute Day celebration today. We also take this opportunity to express our sincere thanks to Professor Balram Aran, Professor S.K. Acharya, for their unstinted support, encouragement, and guidance in organizing this Institute Day celebration. We also express our sincere thanks to Professor O.P. Kharbanda and his team of KLVIC CMET, all faculty members from various departments, students of all the departments, for their significant contribution and efforts in organizing this health exhibition today on the event of Institute Day celebration. We also take this opportunity to thanks our engineering service department, Shri Manju Rastogi and his team, for putting all efforts in making this event possible. We congratulate and express our gratitude to all awardees, faculty and students, and winners of the A.I.M.S. logo and tagline competition for being with us today. We also thank all the members of organizing committee, particularly Shri V. Srinivas ji, Deputy Director Administration, Professor Y.K. Gupta, Professor Radhika Tandon, Professor Savita Yadav, Professor V.K. Bansal, Professor Pramod Garg, Shri Rajkumar ji, Senior Financial Advisor, Amit Gupta, for their continuous support in organizing this event. Last but not the least, we express our sincere thanks to all the members of media, all the staff members, members of sanitation department, security personnel, and all other staff who have contributed in making this event a success. We thank you all for being with us today. Thank you very much.
Thank you, Sanjeev, and the inaugural ceremony comes to an end. Thank you, ladies and gentlemen. The lunch awaits you in the quadrangle.